Many of you will be wondering, what is the benefit of being on your employer's health insurance plan when you already have a health card from your own province? What you have to understand is that the Canadian health insurance program does not usually cover all medical costs. Things like your vision or your dental or your prescribed medication. Yes, you can get your checkup done, but you still have to pay for your medicines, which can be quite expensive. Even the therapies and massages are only covered up to some extent. Each province has its own health insurance plan. For example, Ontario has the OHIP, which stands for Ontario Health Insurance Plan. You will only be covered under this plan 3 months after arriving into the province. So, what are you supposed to do until then? Now, you could get private insurance and pay out from your pocket every month, or you could tell your employer if he can put you on the company's insurance plan. The benefits of being on an employer's health insurance plan is that you can get your dental and vision checkups done. Any medicine that you buy will be reimbursed in full or partial by the insurance company depending on the plan. And some insurance plans even allow you to get massages up to $1,000. And once you do get on the plan, usually it's not just you that is covered, but your whole family instead. And this can be very handy. I mean, I've had friends who've had to shell out hundreds of dollars just to replace a tooth cap. Now, most large companies in Canada are required to put their employees on the company health insurance plan by law. But for this, a person needs to be a full-time salaried employee with the company. If you're hired by the company on a contract basis for a certain period of time, or if you're paid on an hourly wage basis, this plan will not apply to you. Some companies have a time period before you put on the company's plan, such as if you're on probation. So I recommend you speak to your employer about the company's health insurance plan, because this will save you a lot of money. For those of you looking for a new job, I recommend you speak to your potential employer about any health benefits that the company will provide. And for those of you working as a contractor and getting paid on an hourly basis, I recommend you get your employment terms changed or tweaked so that you get paid as a salaried employee of the company instead. For example, if you're working full-time 40 hours a week and getting paid $25 an hour, it is the same as working like a full-time salaried employee getting paid $52,000 a year. And that is why it makes more sense to be a full-time salaried employee of the company instead of being a contractor whose employment agreement has to be renewed at the end of each contract. But if you still cannot get on the company's plan, another thing you can do is pay your employer to be put on the company's plan, because your employer will be getting much better rates than you with more coverage on the plan. Why is that? Because large companies usually buy a large package for a number of their employees, and that is why they get B2B rates. No matter what you do, make sure that you and your family are somehow covered, because you might think that you don't need it yet, but when you start adding even the little cost of purchasing medicines, it can add up to a huge amount. And I know most people delay getting their checkups done just to avoid paying a huge amount for something small. So they let their pain fester until it becomes something really big. At least this way, you don't have to think twice before getting your checkup done. I hope you guys like this video. Please make sure to like, share, and subscribe, and comment down below on the kind of benefits and plans that your company is providing you.